Okay, well, we'll go ahead and get started here. And I'll give a little intro and then I'll hand it over to Dr. Willis, who's joining us on the call. So I just wanted to start by welcoming everybody. I think all of you know me, but I'm Max Corton. I'm the director of Marin County Parks, my usual job, and then coordinating this Marin Recovers effort is my role with you all today. And so this is a call with all of you. It's both the industry advisor leads from when we were initially developing the guidance for Marin County, and then it's also the group that's been convened by Supervisors Connolly and Arnold, the Marin Economic Recovery group that's been meeting weekly, including the chambers and many others. So, and I just wanted to start by thanking all of you for your leadership and partnership in this effort. So we've asked all of you to join this call today to talk about this new state framework for reopening that was announced on Friday by the governor. And in just a minute, Dr. Willis is going to talk about that framework and talk about some of the changes that are likely to come from that. And then also to answer questions and provide discussion. One of the things that's likely to happen is the state is taking a stronger role in the reopening, which I think is a good thing. And one thing it's going to allow us to do is to defer to the state in a lot of our guidance as different sectors reopen. And so one of the things that we're likely to do is start deferring to the state guidance instead of the Marin specific guidance. And as we do that, I just want to thank all of you for your work to develop the guidance, the Marin specific guidance that we've had. I think it's been really, really important allowing different sectors to reopen, and you all had a really important role in your leadership in developing that and providing feedback and refining that guidance. So I really want to thank you for that. And of course, as we potentially just deferred to more of the state's guidance, there's still the possibility of retaining some Marin specific guidance. And one of the things that I'm interested to hear both today and in the future is if there's specific aspects of the Marin specific guidance that we want to keep as we more and more defer to the state's guidance. And then there'll be an opportunity at the end of the call after Matt's presentation to answer questions and discuss. I'm not sure if they're on the call or not, but I just wanted to thank Supervisors Connolly and Arnold for their leadership in convening this group and just providing a forum and a strategic sort of backbone to our work of reopening the different sectors in Marin. So thanks so much.
Thank you, Max. I'm here.
Oh, good. Thank you, Judy.
Okay. Yeah.
And anything that you want to add,
No.
Judy, before? Okay. All right.
No. Okay.
Well, with that, I'll turn it over to Dr. Willis. And just as a FYI, I'm recording the session and we'll upload it to the Marin Recover site to provide info for those who aren't able to make it.
Great.
Good morning, everyone.
Morning.
Nice to see you all. Matt Willis, Public Health Officer. I'm just going to go through what I've learned over this is an announcement that the governor made on Friday afternoon. And so there's been a lot of activity over the weekend trying to interpret what this means for us in Marin and seeking clarification from the state. I think we know a lot more now than we did even Friday. And this is, I think, going to be an important organizer for our response here in Marin County for really what remains of the pandemic response. The state has, as Max suggested, the state has really, I think, finally achieved that role of kind of a standard and more uniform statewide framework that it's been struggling to achieve thus far. If you remember, we're coming out of a phase where the state guidance was really organized into two tiers. We were either on the monitoring list or not on the monitoring list. And in fact, the majority of counties ended up on the monitoring list. So there were sort of two settings, it was on or off. This new framework is much more nuanced, and I think offers us an opportunity to really tie ourselves to the state guidance and move forward according to which tier we fall into. And I'm gonna go through that tier process now with you, so we all have a common understanding of what this means. Just want to start with reminding us that we recognize that as we navigate these choices around policies and COVID-19 response, that we're defining health as not merely the absence of disease or infirmity, or not merely prevention of COVID-19 infection, but recognizing that health and well-being is really comprised of complete physical, mental, and social well-being, including economic well-being, and that brings us into some difficult decision-making together civically, and we're doing our best at each stage to balance the risks and benefits and applying what we know about the science as the science evolves. And I want to just express my gratitude for all of you and Marin for a successful navigation of those questions thus far, and I hope that we can continue in that vein. So this is just to remind us of what we've achieved over the past month or so. Our case counts are dropping in Marin County significantly. We now are close to that cutoff of where had been the monitoring list. You see that 100 cases per 100,000 over the past 2 weeks. And I just want to share with you that this graphic, because it represents the trend. We'll see that those cutoffs have actually changed in the new framework. But this is positive. I want to also be careful not to be too celebratory about this success, because we know how tenuous this is, and we could easily lose the gains that we've achieved. We've also seen a decrease in our percent positive tests. So when you see both a decrease in the total number of cases and a decrease in the number of percent positive among those that are being tested, that's encouraging that you're actually seeing less transmission, especially what this graph represents, especially when your testing rates, as ours have been, are largely unchanged. So these are all positive signs that we are being successful thus far in the practices and procedures we've adopted to flatten the curve in Marin, and we need to continue to do more of same, especially as we think about the new reopenings that the new framework will offer for us. So here's that framework. It's the COVID-19 blueprint, they're calling it, launched on Friday. The state is divided, we have 58 counties, and each is placed into one of 4 tiers according to the burden of COVID-19 as measured in 2 indicators. So fewer total indicators. The state is now categorizing counties just looking at the positive case rate per 100,000 per day rather than over a 2-week interval, and the percent positivity. Those are the kind of the 2 primary indicators. And using those, Marin County is in tier 1. We are among that majority of counties that are in that purple highest burden tier. There are 38 of 58 counties in that tier, and it's being reassessed weekly. However, we are likely to move into tier 2 shortly, and I'll cover that in a bit. These are the metrics that correspond to those tiers. So that highest tier, widespread spread of COVID-19 is more than 7 cases, new cases per day per 100,000 residents. That correlates pretty well to what we have been talking about as being 100 cases per 14 days per 100,000 residents. It's just easier, and I think more intuitive, and the state decided to move to a daily rate for our target setting and understanding rather than a 2-weekly rate. The number itself of cases is about the same. This correlates to about 98 cases per 100,000 per 2 weeks. And then they're also looking at our percent positivity rate. So if we have more than 8% positivity, we will fall out of whatever tier and have to go into a more restrictive tier. Either of these, so either case rates or percent positivity, if we are above that metric in either of them, that is the number that they look to determine which tier we fall into. Fortunately, in Marin, these are our numbers now. So we have our percent positivity is 3%. and we have 5.9 cases on average per day per 100,000 residents. So we fall beneath that cutoff of 7, and we are beneath that cutoff of 8% positivity, which means that though we start in tier 2 because we are currently on the monitoring list, we meet criteria to move to tier 3, especially when the case counts are adjusted. And I'll just spend a moment talking about that. The state has decided that counties that do a lot of testing, it makes sense that they find more cases. And Marin County has among the highest testing rates in the state. We've adopted that strategy because we know that this is one of the most effective ways for us to prevent transmission, is to understand who's infected, and even among those who are asymptomatic. So we have done a lot of testing of critical, infrastructure, healthcare workers, essential workers, et cetera, who may not have symptoms, just for screening purposes, and then trying to make sure that anyone who's having symptoms is also tested. Because of those high testing rates, we are being given credit for high testing rates with the coefficient that is added to that number. So it actually down adjusts our total number of cases. In our case, we would multiply our raw case number by 0.7, and it would adjust our case rates for the purposes of which tier we fall into. So if we have 100, say, 100 cases per 100,000 per 2 weeks, that 0.7 would bring it down to 70 is the number that they would use for calculating which tier we fall into. So because of that, high testing rates and improvement in transmission in Marin, we fall into among 7 counties that are flagged to move into tier 2, which is the red category, the substantial risk category, on September 8th, unless there's a significant change in our numbers. So I want to be clear that these are all, this is for planning purposes and for forecasting, and that has not been made official yet. So these are some of the key features of the new blueprint. It's statewide, so it's the same set of rules for everyone across the state. There are mandatory metrics for all counties, as I mentioned, case rate and test positivity. There are 4 categories instead of 58 different sets of rules. Part of our experience here in Marin and across the state is that because there wasn't strong state guidance, both guidelines by sector or even categorizing by risk and incidence, we were doing all of this work locally. And in the Bay Area, fortunately, we had a strong regional presence of public health, and we're able to approach many of these questions regionally. But we welcome the state's leadership now to have only 4 categories that are a simpler framework rather than 58 different sets of rules. It is also a slow framework. You have to spend at least 21 days in any tier before advancing to the next tier. So one of the lessons learned with the previous approach was that there was, as counties applied for the attestation or came off the monitoring list, when things were able to be opened really quickly, there was often a rapid reversal in the progress that had been made. So the state has said that, if we move, for example, for us moving from purple into red, the earliest we could move into orange, if we have lower case rates, would be 21 days after we moved into that red category to prevent too rapid progression moving forward. And we need at least 14 days of sustained improvements before advancing. It's also an incremental approach rather than an on-off switch as it was before. Sectors can progressively open more operations in each tier. So you'll see that the first sectors, if we move into the red category, we can open certain indoor activities at 25% capacity. And then you move into the next category, which is orange, you can expand that to 50% capacity. So it's more elastic and more progressive rather than an on-off switch for each sector. And then it's also responsive. This framework offers guidance for how to tighten back up when conditions worsen, and so so we're able to recognize trends and act upon them more quickly. This is how the moving back process works. If our adjusted case rates or test positivity has been within a more restrictive tier for 2 consecutive weeks, the county will revert to a more restrictive tier. So it's the rates at the county level are measured weekly. Again, test positivity and case rates. If our rates correspond to actually the more restrictive tier for a 2 weeks period, we'll move into that tier. We would have 3 days to implement any sector changes or closures if we move backwards. And of course, at any time, state and public and county public health officials can determine interventions if we're seeing hospital surge issues or drivers of disease transmission that have changed. We can make an executive decision to move back in collaboration with the state, even if it doesn't meet those other criteria. These are the risk criteria that they're using in the framework that I'm going to be sharing with you, which sectors are going to be able to be opened at different tiers. And I just want to share with you before that these are the assumptions or the criteria they're using to make those determinations. The first is the ability to accommodate face covering at all times in that setting. Second is the ability to practice physical distancing in any given setting, just between individuals from different households. The ability to limit the number of people per square foot, obviously crowding, increased risks of exposure. Ability to limit the duration of exposure. I've talked about this before, that the risk of exposure is really based on the amount of time and the proximity, especially if, and then the presence or absence of facial covering. The ability to limit the amount of people mixing from different households and communities. The ability to limit physical interactions between visitors or patrons, optimizing ventilation, indoors versus outdoors. And one of the themes that we've been pursuing in Marin has been moving things outdoors as much as possible. And then the ability to limit activities that are known to cause increased spread, such as singing, shouting, or things where there's more respiratory secretions being moved into the environment. So those are the criteria that they've used to develop the sectors, and this is much more prescriptive than it has been in terms of which sectors can open in which tiers. And I'm just going to go through them quickly with you here so that we all understand kind of where we are. Again, our goal is to tie ourselves in Marin to what the state allows for each tier as we move through this framework. So we are starting in tier 1, and you'll see the tiers are the columns and the rows are the sectors. So we'll start just with the first row. Critical infrastructure has obviously been open at every tier and remains open. Certain limited services, I'm not exactly clear what limited services means, but they have been open also. And then hair salons and barbershops, this was a change. They actually made a decision to allow hair salons and barbershops to open indoors regardless of which tier you fall into, including the most restrictive tier. So we made that decision, to move in accordance with the state yesterday. So yesterday, people were able to get haircuts indoors in Marin County, and that will obviously maintain throughout any tier. So as we move into red. For retail, it's indicating that we would have to be at 25% capacity if we stay in tier 1. Because we are slated to move into tier 2, we are not going to, right now we are at 50, our guidance is at 50% capacity for indoor retail. We will stay at 50% capacity, anticipating that we will make that on September 8th, that being in tier 2, we will be able to move to 50% capacity. If we do not move into tier 2 next week, we may need to actually change our indoor retail guidance to match where our position in tier 1 and move down to 25% capacity from our current standard of 50% capacity. Shopping centers and malls, this is also a change for us in Marin. Based on being in tier 1, we are now able to open indoor malls. That's a change in the state law at 25% capacity. So Northgate Mall is now able to open at 25% capacity. If we move into tier 2, it will be able to open to 50% capacity with some limitations in terms of the food court, et cetera. Personal care services have been outdoor only. This is non-haircutting related personal care services such as estheticians, facials, nail salons, et cetera. Tier 2, they're able to open indoors with modifications, and those modifications would be consistent with the standards and the guidance we've already developed for those sectors. Museums, zoos, and aquariums are also able to move from outdoors to indoors with 25% capacity in tier 2. Places of worship have been closed in Marin, and they've been outdoor only with modifications. Moving into tier 2 on September 8th, we would be able to have some indoor worship services at 25% capacity, or 100 people, whichever is fewer. Movies, the next sector, would be able to open at 25% capacity, similar to the worship services. Hotels and lodging, which are open now, the only change in tier 1 and tier 2 would be the fitness centers, where they are in those settings, would be able to open at 10% capacity. And then gyms and fitness centers as a sector, which are now only able to work outdoors, would be able to open indoors with modifications at a 10% capacity. And those capacities are based on what the fire codes in terms of the maximum capacity for that space. Restaurants, now, as you know, only open outdoors, would be able to open indoors with 25% capacity or 100 people, whichever is fewer. Wineries are outdoors only. Bars, breweries, distilleries where no meals are provided are closed, both in tier 1 and tier 2. I don't know if we have family entertainment centers or card rooms. Offices, so non-essential offices are closed in Marin now in tier 1 and will remain closed also in tier 2 according to the new state blueprint. So that non-essential office workers would need to work remotely. So those are that's how the sectors line up with the tiers and what we can anticipate in terms of our planning for Marin. The new website at the state is also really helpful for this. There's obviously a lot of questions that arise when these sorts of large-scale changes are made and recommendations. The website is really a lot better now at the state and can answer a lot of those questions. There's an FAQ section, there's queryable sections, and one of the best tools is you can sort by county. So if you go into covid19.ca.gov, bring up Marin, you can actually bring up any sector, and it'll tell you what the status of that particular sector is for this county and any other county you're interested in checking. So this is our challenge, and this is the same slide that we've been using all along, and it still holds. Our challenge is, how do we safely continue to reopen knowing the virus is part of our environment? We do it carefully, we do it together, we optimize self-measures, we recognize and we mitigate risk, we're following the data, we're enforcing the laws, we're adaptive and flexible. We have to rethink assumptions of how things are done. I think the governor said we have to live differently in his announcement on Friday. And I've added this bullet now, and we follow the state framework. So just to summarize, we're going to start in tier 1. We opened hair salons and indoor malls yesterday. We anticipate a move to tier 2 September 8th. Barring a significant change in our incidence or percent positivity, which is statistically very unlikely, we would take that step. But that would be announced on officially, I think, on Friday. We would know for sure. And it's due to decreased case rates in Marin through August and high testing rates. We're able to make that step. The indoor restaurants would open at 25%, indoor retail at 50%, movie theaters at 25%, indoor worship at 25%, personal services indoors at 25%. And then adding schools, TK through 6 schools on September 21st, and it wasn't included in those sectors, but this is an important point for us in Marin, is that in the red category in tier 2, all schools may open to classroom-based learning if you remain in that category for at least 2 weeks without a change. And so what that would mean for us is that on September 21st, schools could reopen to classroom-based learning. We will be making sure that every school that does seek to reopen would be completing the site-specific protection plan that has a 30-point plan that we worked with Marin County Office of Education, with very specific recommendations to how to open schools as safely as we can, ensuring that they're in compliance with all of the standards, including testing standards and working with public health. We have now 16 waiver applications that have been completed, and another 9, I think, have been sent for this week. That was last week, and have been sent forward to the state. If we enter tier 2, there is no longer the need for a waiver from the public health officer for schools to open.
Mm.
And then finally, just reminding that as we reopen, we're really going to need to emphasize more than ever personal responsibility and awareness of risk and enforcing the laws. I want to be clear that just because it's open doesn't mean it's safe, especially for some people. You know, the dynamic of public health being responsible for preventing any form of risk through legislation and policies, I think we need to move into a more mature and sustainable approach to this, where we're really emphasizing people's own awareness and ability to navigate decisions for themselves and taking into account their social responsibility to others, and moving forward together. So that's a summary of the new blueprint, and I'm happy to answer any questions.
Hi, Matthew. This is Judy. Can you hear me? Matt?
Yep.
Okay. I have a number of questions that have come in while you were talking, so I'm just going to start with that, okay?
Yep.
The first one is, please explain how capacity is calculated. 25% of what?
25% of the max capacity. So, and you can correct me, Max, if I'm wrong, but you know, every business establishment has a max capacity for that space, and it's based on fire codes, and it would be 25. Just key off of that. It has to do with square footage.
Okay.
And it should be called out in their site-specific protection plan. So that would be a way for like the public to know how they're meeting that criteria.
Great. Thanks. Okay. And then can you clarify if we need to stay in our current tier for 21 days, or will the tier review take place on September 8th? And I think I know the answer to that, but go ahead.
Yeah, the first, so this is launching on September 8th. So we would be able to move into red on September 8th, and we are not stuck in purple for 21 days. But
Okay.
then once that decision, then we would need to stay in any tier for 21 days before moving.
Okay, right.
Judy, I answered a bunch of the questions in the chat as we went.
Oh, perfect. Okay.
So those are in the
Thank you.
chat bar. There are a couple at the very bottom that didn't get answered, which
You wanna read them?
which was public and private events and outdoor events was not addressed. Any info on this?
What was the question? Public and
It's
private?
essentially public and private events, indoors and outdoors, so gatherings of groups.
Yeah, so the framework does not allow gatherings outside of your immediate household. So social gatherings are still not allowed in the eyes of the state.
And then the second one was for indoor group activities, what are the guidelines, i.e. movie theaters and indoor worship? Is that listed somewhere? How many people can gather?
Right. Yeah. So for each of these, one of the really nice things about this is that for each of those sectors, there's a very specific guidance from the state and what constitutes safe practice. So there's guidance for movie theaters, guidance for worship, there's guidance for restaurants, and as Max alluded, we were developing that own guidance with your help in Marin Recovers early on because there was no state guidance available, and it's really fortunate that I think the guidance that you all developed for us ends up aligning really well with what the state ultimately ended up creating as their guidance. But because the state is also now legislating what we can and can't do, it makes a lot more sense for us to, wherever possible, point to the state guidance itself, because it's thorough, it's appropriate, and it's the law. So that's where we're going to start pulling out where we can the Marin Recovers like locally specific guidance and replacing it with state guidance, unless there's sort of a glaring omission or some issue that would, based on local context, that would lead us to add or keep some element of our own local guidance.
The next question is, can you address enforcement of the capacity limits? And I can address that, Mike. I think there has been a change in enforcement over the past week, and it's been, I think it's ending up that it's going to be easier for local jurisdictions to enforce than for the task force model to enforce. And so we're sending out a press release shortly, probably within the next half hour or so, that lists the email address for every single jurisdiction and where you would give them information about a complaint, a business-related complaint. So similarly, those agencies would also enforce on capacity. They know where the capacity limits are on your SPP, and would be the ones coming into the businesses to enforce if there are overcapacity limits. So watch for that press release, and I think it will just provide quicker responses to complaints that are received. We've only issued a couple of citations, have had over 100 phone calls and follow up with businesses, and most businesses, upon learning about their areas of deficiency, have corrected them, and we haven't needed to go to a citation.
Mm.
Will the state guidance be posted on the Marin Recovers website? Yes, we can absolutely make sure that happens. And we will also make sure that you all get copies of these slides.
And this video also the Zoom session will get posted. And then one thing is, as we update to the state's guidance, if you look under the sector that you're looking for, there will be a link to the state guidance for that sector. So it'll say, here's the guidance to follow, and then the link to the state guidance.
Mm.
Yeah,
The office.
and I don't want to overpromise clarity in terms of the state guidance. I mean, we
Okay.
Working on it.
Yeah, I mean, so we know we're not totally out of the business of guiding where we need guidance, because the state isn't. There still remains ambiguity in some realm, and so we will stay engaged, through Marin Recovers, and IS Health Officer and our team will help navigate where it's not clear in the state guidance. We'll help with that.
The office sector is not open in Tier 3, but may open under certain conditions in Tier 3 in October at the soonest. What are the conditions under which the office sector can open?
So it's going to be tier driven. So if it's Tier 3, I don't have the tiers in front of me now, that if it's Tier 3 that offices can open, I think it is,
Yes.
then the conditions would be the case rate that corresponds to Tier 3 and the percent positivity that corresponds to Tier 3. And those are by definition, the conditions the state looks to.
The sectors that are already open, outdoor dining, et cetera, do they need to complete new site-specific guidelines and post at their business? Max, you want to take that?
Yeah, I think they need to update their guidance. So every time the guidance changes, businesses would just need to update their site-specific protection plan.
Miriam, I'm not clear on the indoor policies, even from what's on the state site. Is there still a requirement for 6 feet of distance when gathering inside?
Yes.
Matt? Yes. So still social distancing unless you're within your household. Required everywhere.
Yeah. And that's a good example of how the state, probably could have been clear on that point.
Max, can you please let everyone know when the session is posted?
Will do.
Great. Do you anticipate increasing capacities permitted in outdoor recreation? Example, number of lap swimmers per lane, number of passengers on a charter boat, etc.
Yeah, I think we'd be looking, and it's another sector where we could consider adopting the state guidance. And so it'd just be helpful, I think, especially for all of you who've been engaged in this process, as you look at this new the updated state guidance, and then compare it to our guidance. That's what we're going to be doing as we consider deferring to the state. But for all of you to look at that too, and let us know if you see anything that stands out that we should keep from our local guidance, please let us know. That'd be very helpful.
Yeah, and there's a metric now that we can key off of, which is that 10% for indoor fitness, which can apply.
Is that the gyms?
Yeah.
Oh.
Yeah, gym, fitness and gym. Yeah.
Although just to call out, indoor pools still are not allowed to be open until the Tier 3.
Okay, but gyms can open now.
Yeah.
No,
On
September
the
8th.
September 8th. Yeah.
Well, right. I think it's September 8th.
I don't know what 10% of a gym looks like, but I guess I'll leave that to the experts. But Omar is asking, is periodic COVID-19 testing for the employees of the businesses that are opening required or a recommendation?
It's a recommendation, not a requirement.
Is that it?
Judy, that's the
Great.
end of the ones I didn't answer.
I'd say, we still have a little bit of time, another 20 minutes for this meeting potentially. So if folks have additional questions, feel free just to unmute yourself and ask. I want to make sure we
Yes.
have an
Oh,
opportunity.
great. Thanks.
Before we get to questions, I see Stephanie, I've got you. But let me just say there's another layer. If we sort of understand that as the basics of the framework, there's another piece that I want to add, which is they're going to include other secondary indicators that might prevent us from moving one way or another. And one is an equity indicator. So even if we met criteria for moving forward in those two that I mentioned, case positivity and percent positivity among tests, if we are failing in an equity indicator, we would not be able to move. It is very likely that equity indicator relates to testing rates in low-income communities.
Mm-hmm.
And so it's a really good way to make sure that counties aren't sort of gaming the system, because if you're not testing in the areas where they're most vulnerable or the likely highest rates, you could end up with high testing rates and low percent positivity and low case rates. And so the way to adjust for that is to numerically ensure that counties are testing a certain proportion of their residents who are low income. And that's, fortunately, that's consistent with the approach that we've taken thus far. And when we forecast where we would score in that equity metric, we score well. So our current approach would not prevent us from moving forward with that new equity indicator.
That's
that
great.
will be clarified next week.
Good. That's good to hear.
Stephanie had a question.
Hi. First of all, thank you so much. This has been incredibly helpful and useful based on the questions I'm getting. My question is a bit specific. It's related to, I have a client that's been in touch that is a yoga instructor, but it's a therapeutic yoga. So they have contracts with the hospitals, and yet they fall under the gym category. Is there a way to get some sort of medical waiver? Is there any waiver process that's available on the county level for, it's a hyper specific example, but it would be the equivalent of therapeutic massage versus, spa massage. And she's just not clear how, right now she's just been closed, but was inquiring. So.
Yeah, physical therapy is allowed as a medical procedure. So if it's framed as physical therapy broadly, or as a form of physical therapy, then it would be allowed. We have broad allowances around essential services that are medical. And so that would be where that would fall.
Is there a set of guidelines that she should look to and I just haven't even looked on the site. Is there a set of guidelines for physical therapy that is on somewhere?
Yeah, if you could, it's so case specific. If you could just, Stephanie, connect with Max and me, maybe
Sure.
just to what the specific circumstances we could help.
Absolutely. I appreciate it. Thank you.
Julie had a question.
Yes, and I know Max and I have talked about this, and we talked about it yesterday at our meeting, is the restaurants getting their workers tested and a faster turnaround for them. I have examples in Sausalito where our restaurant employees have stood in line from 9 in the morning till 3, and they're not getting a good turnaround, so the restaurants are having to close, waiting for those testing to get back. So is there any way that we can really work on this to get some restaurant testing for, I have 57 restaurants, so a lot within my community that need to have better access to testing?
Yeah, some of this has to be communication, because we had a testing operation in Southern Marin specifically to answer this question using our public health lab testing with a 2-day turnaround. I think we had 100 tests available. About 22 people showed up, and our understanding was we actually communicated with the chambers and the restaurants to say, send us your employees. It was located, the testing site was located at Marin City, and it was disappointing to see we had sent all those resources down there, and had such low turnout. So there's some of this it's also the behavior of the restaurant owners and the employees to move. So sometimes the sort of the stories of where it doesn't work get legs, and the stories of where it can work don't always penetrate. I mean, there are, the answer is yes, there are opportunities for people to get tested in those sectors. If we make a decision that we'll make it available, but if no one comes, then we'll close that testing operation and move elsewhere, because we have to match demand.
So, and I think it was the time of day, 1 to 3, most of those employees, if they're serving dinner, they're already at work. So I think it was the time of day, 1 to 3 in the afternoon was the difficult time for the employees to get down there. I mean, if you have a restaurant, morning times are better, and they have different shifts. So I think it was the time of day, and we did send it out to our restaurants.
Okay, yeah. I mean, so the other message around testing. Testing is a really important and dynamic space. And I'll just briefly summarize where we are right now, which is there's more and more testing technologies coming online, including inexpensive, rapid methodologies. The state has now committed to, in November, 150,000 tests per day statewide, which for Marin would correspond proportionally to about 1,000 tests per day available to Marin County residents at a laboratory that's being built by the state. And so that would come online early November. And then we're also issuing a health officer order that all of our medical providers above a certain number of patients need to be able to offer testing to their own patients. Kaiser is doing more testing, Marin Health is doing more testing, Sutter is doing more testing. It really is a matter of healthcare responsibility more than public health. We're going to be reserving our public health testing resources for those that have no insurance, or those that are involved in outbreak settings or other critical infrastructure. And so the answer is, first, that people should reach out to their doctor, to their healthcare provider. And doctors are required by law, healthcare and insurers are required by law to offer testing for screening for essential workers. And this, as you may have seen in the media recently, some controversy around the CDC's announcement that people who don't have symptoms don't need testing. California Department of Public Health, Northern Marin County Public Health look to that as the guidance. We really recognize the need for screening testing for asymptomatic people in critical roles, and our healthcare providers are required to offer that. So that's been a slight shift in our approach. Having said that, we still do have testing resources available for the public at the LHI site in Centerville and at the color testing site near the Civic Center. And then these pop-up sites like the one we did in Marin City for certain sectors. And the turnarounds are much quicker now. Sorry, I'll just end with that. That we had I think there was a period there collectively where turnarounds were like 7 to 10 days across the board. Quest Diagnostics, Kaiser, et cetera. Just limited reagents, and the demand for testing was so high, especially in July. But now average turnarounds are between 2 and 4 days across the board.
Yesterday, I tested at Color at 12:30, and I had results back this morning at 6. So very fast. Matt, a follow-up is, are you still strongly recommending that our older population over the age of 65 continue to shelter in place as we enter into tier 2?
Yes. Yeah. I mean, one concern I have is that the atmosphere, the tone that is set by reopening is inevitably interpreted as the coast is clear in some way, that we can relax. And it's really the opposite. It's really to think of it as, in order to take these steps that we want to take for the sake of our economy and for the sake of our business and for other things that people value, we need to be even stronger in these other ways that we can protect ourselves. Because what could easily happen is that as we move forward into this next tier, if there's a lot more mixing, we would see more transmission and we would have to shut down again. So, we know that our older residents are by far more vulnerable to mortality. 95% of our deaths in Marin County are among people age 65 or greater, and so that remains an important recommendation. And thanks for reminding us that we need to put that front and center when we talk about these changes.
Stephanie, is testing required for restaurants? It's recommended, not required. Have our approved cohort sizes decreased from 15 to 14? If yes, effective now, and why the one participant?
Yeah,
I think that's for youth programs.
That's youth programs, yep.
and the answer is yes. And it's yes, and it's because the state. It's an example of how we came up with our own, and then the state came out with theirs, and they're almost exactly the same, but in this case, a painful difference of one.
So that's effective now?
Yeah.
But we are updating our guidance to, so far right now our guidance is still the old guidance that said 15, and it should be updated either later today or tomorrow. And we have a Zoom call for youth program providers tomorrow at 4 to discuss the updated guidance. There's some things that were not super clear in the state's guidance, so we're trying to help clarify those.
Just
And just to be clear, we don't have a choice there. Also, I mean, that's state law. It's not a matter of having a choice about that for us.
So following up on that, Tori's asking, are we also following child care state guidelines that only 2 staff per class or cohort?
That's an area where if you look at the full language of the state's guidance, that's the recommendation is 2, but there are contingencies where other adults may enter that space as supports, especially for children that have special needs or developmental needs or other needs. And so we are choosing in our FAQs to be clear that there are many sorts of or types of cohorts of children where you would find more than 2 adults involved.
Any idea on how the new guidance will impact support resources available to individuals and businesses, i.e. unemployment support? For example, a restaurant that legally can open, but at 25% that isn't economically viable. I don't have a sense of that unless Max or Matt do.
No, I don't think it's addressed in the guidance.
No. Is there a guide for self-employed individuals who provide home cleaning services or childcare services? There's not a guide specifically for self-employed individuals, but there are site-specific plans that if someone is running a cleaning service that they would abide by, and they would just keep a copy of their SPP with them in their vehicle, they would obviously have nowhere to post it. Lots of really good questions. Thanks, everybody.
So 2 more I have. The September 8th is the day that nail salons can open, gyms can open. Is that correct?
We're forecasting that, but we can't say for sure. Yeah, but
Okay.
we don't want to get in a situation where on
Yeah.
Friday we say yes, and then it's we didn't have.
Got it.
So I would say those establishments should prepare for the likelihood that would occur.
Okay. All right. But if things are measured weekly, correct?
Yeah.
Okay.
Oh, yeah. There's updated data daily.
Okay,
Right, Matt?
great. Okay.
They would change
Yeah,
tier.
the data is updated daily, but the measurement according to which tier we fall into is done weekly.
Okay.
And it looks at weekly averages. So it doesn't look at a daily rate. It looks at the previous
Weekly.
average rate.
Okay, great. Okay. Thank you. That's all I have. Anyone else? I think this has been incredibly helpful, and I'm so glad for all the people from business communities that have come in, because I think you're going to be called upon to know this very well and thoroughly. And Max, And Matt and Angela, thank you again for all the work that you're doing. It's huge. And thank you for sharing it and thinking to share it today. So if there's nothing else, you know where the website is, you know where the phone numbers are. I could say if all else fails, call Josh Friday, but I'm not going to.
All
No.
right. Thank you,
Okay.
everyone.
Thanks,
Thank you.
everyone. Take care.
That-
Thank you.
Bye.